you?
Good.
Today I'm going to teach you a skill. As nursing students, we all know that teaching a colleague is a very important role for us because during the procedures we can exchange our information and experience of the placement, and it's very good for both of us.
Yeah.
So today I'm going to teach you a skill which is how to identify the differences between the oxygen delivery devices and their functions and features.
Yeah.
Yeah, so firstly, let's start from the nasal cannula.
Yep.
So, have you ever seen this one before during the placement?
Yeah, sure. Of course.
Have you ever used this one before?
No, we are not allowed to use that.
So, when I was in placement, there's a patient has the oxygen saturation is out of his acceptable parameters. So the nurse just give the nasal cannula for him and supply some oxygen for him. So when we connect the nasal cannula with the patient, usually put the small tube into the patient's ears. Yeah. And we connect with the oxygen wall.
So what's that for? That's just to make the...
Yeah, it's to make the tube more stable for the patient.
Okay.
So usually for nasal cannula, we will deliver lower than 4 liters flow rate. So that's because it is just coming to your ears directly. So if the flow rate is too high, it will damage your mucous membrane, so it's not really good. And it usually delivers 24% to 44% oxygen concentration. Okay. So this one is a simple mask. It is also called Hudson mask.
Yep.
So when you connect this one with the patient, you need to make sure that elastic strap is suitable for the patient. It's not too tight or not too loose.
Can I try? Can I try?
Yeah,
to put it on?
yeah, you can try to do
Thank
it.
you. So just put it over the mouth and...
Yeah, you need to make sure it's comfortable for the patient.
Okay.
You need to ask him.
Yeah. So I
Yeah.
press the...
Yeah, just make it to fit enough for the patient and make here secure.
Yeah.
And yeah, then we connect with oxygen. Usually for masks, it usually delivers higher than 5 liters because if you deliver lower than 5 liters, there will be no enough oxygen for the can't be flushed into the mask, and the patient will always breathe in too much carbon dioxide.
Okay.
So, yeah.
Yeah, understand. That's good.
Yeah. And we're going to talk about the partial rebreather mask and the non-rebreather mask. Do you know what's the difference between partial rebreather and non-rebreather?
Well, can you tell me, please?
Yeah. So if you can notice the valve, then you can know what the difference is. This is partial rebreather. And if you add the valve into the mask, then this is non-rebreather mask.
Yep.
So the difference is there is a one-way valve here, and if you breathe out of the carbon dioxide, it will come through the hot hole, and it will come out, but it won't come back again because it's only one way.
Yep, yep.
And for both of partial rebreather and non-rebreather mask, they all have the breathable bag here. It is inflatable breathable bag. So if we connect with the patient, it's secure, and you connect with oxygen. And if you find that oxygen delivery is insufficient, which means if the bag is deflating, then you need to make actions like give another mask for the patient or have a check out what's wrong with this bag. And finally, let's talk about venturi mask. So this is a venturi mask. If you look at the picture, can you tell me what's the difference between the venturi mask with the other masks?
It has a special structure here.
Yeah, so this one is called the venturi valve, and from the venturi valve, 100% oxygen is forced to come to the valve, where it will mix with the other room air from the side port. So it will be a mixture gas to deliver to the patient. And another advantage for the venturi mask is it can be preset for fixed oxygen level. So it's, for example, if the patient has COPD, they usually need oxygen saturation from 88% to 92%. So this one is very suitable for the patient because it can deliver a fixed oxygen level, and you can choose what kind of level you want, and you can just deliver to the patient, and it's very useful. Okay, so I'm going to ask you some questions about those devices. So the first one is like, do you know what's the difference between the nasal cannula and the simple masks? If you look at the shape, do you know what's the different function for this? And
if the patient is using the mask, is not able to eat, to drink, to talk.
Yeah, because the
they,
shape,
yeah,
because it will cover the mouth for the patient. So if the patient uses this one for a long time, it is very hard for him to drink, eat, and speak to others. So that's why a lot of patients in hospital will prefer the nasal cannula.
Yep.
And another thing I want to make sure is that the comfortable level for this.
Yeah.
Because this one, although you also need to make sure that the small tubes won't break down patient's mucous skin inside of the patient's nose, but it's a small part, so it's better for the mask. The mask will have a larger side of the around the mask and elastic straps. So always make sure that the tight elastic strap may break down the skin around the patient, and it may, if it feel not really comfortable, the patient will feel very very unwell. And another question I want to ask you is like, do you want to conclude the differences during the several devices? Like, how do you think about in which situation you need to use the partial rebreather, and in which situation you need to use a simple mask? It usually depends on the person's situation, right?
I think in the world we usually use the nasal cannula.
Yeah.
I think that one should be used in the emergency.
Yeah. And another thing I want to ask is like, you know the differences between the high flow system and low flow system?
Okay. Yeah.
So you don't really know that?
Can you tell me something about?
Yeah, so actually for venturi mask is actually a high flow system.
Yeah.
And for the other mask it's a low flow system. So the difference between the venturi mask and the other mask is like the high flow system can provide oxygen level which is higher than the person's high inspiratory rate, and the low flow system which provide a lower oxygen which lower than the person's highest inspiratory rate. So that's the difference.
Okay, it makes sense.
Yeah. And another thing I want to make an addition is like the humidification and the nebulization. So during the oxygen delivery, the humidifier and nebulizers are required, and for the humidifier it is required usually if the patient have a potential of a very dry mucous membrane, and also for the patient who has a tracheostomy or they have a really thick airway secretion, and just the thick secretion will make them very uncomfortable, and just to reduce the oxygen concentration. So it's very useful if you use a humidifier to clean the airway for them. And for the nebulizers, it's like kind of things to convert the liquid medications to the droplet, so it can be easier for the patient to and inspire this kind of medicine to their lungs. So that's better. Also, I want to give you some example of my personal experience during the clinic placement. So for the placement, it usually as a nurse, the nurse rule is usually like, as we previously said, that if you find the patient's oxygen saturation is out of his acceptable parameters, and you need to ask the doctor or discuss with the other nurse or ask the patient if the patient is like short of breath, and let him to have a deep breath or cough and measure his oxygen saturation again. And if it is still low, you need to make sure you really understand what the differences between the different oxygen delivery devices, and you can give the suitable devices for the patient. And the other experience is like always to have a look about the patient's note, and there will be some prescription from doctors, because oxygen sometimes will be a drug. The doctor will order the oxygen for the patient, and for different patients they will order different amount. So you need to make sure, and if you're not really sure, you need to double check with the other doctors. Is that okay?
Yep.
Okay, and that's all. I think you did very well, and you have a well understand of that what the differences between the oxygen delivery devices. And another thing I want to ask you is like, after we finish of the oxygen delivery, do you know what else we need to do? Like waste disposal and hand hygiene, something. So always remember before you touch the patient and finish the procedure, and you follow the rules of hand hygiene. And you also need to remember if this devices is for this patient, can it be reused for another patient?
No,
Definitely not, right? So if the patient is discharged, you need to take this one into the bin. It can't be reused. And for the same patient, do you think it's okay to always keep this one for the patient if we don't clean this one? So we always make sure the side around the mask is always clean, and to keep the patient's the face all clean and to prevent the infection. Okay. Okay, so finally, let's do some evaluation. So I'm going to ask you several questions for your feedback. Do you think you learned something from this skill teaching? Right? And what's the differences you can learn from this teaching?
I know the differences between different types of oxygen delivery devices, and the differences between the high flow of oxygen and the low flow of oxygen, and something else. And I know the different situation, the different devices for different situation.
So how do you think about oxygen? Is it always safe? No.
Safe.
No, definitely always safe, right? if you give like 100% oxygen to a patient, do you think it's good?
I think that would be toxic for the patient.
Yeah, because if a patient's exposure to a long-term 100% higher concentration of oxygen, it will be dangerous for the patient and it will cause oxygen toxicity. So you must to know a lot about the mechanism of the oxygen delivery. And you also need to know that oxygen is not always safe.
Yeah.
So to make sure that during any placement or any practice, you need to know, you need to think that it is always safe for a patient. Okay.
Okay.
So do you want to give a conclusion for this activity? Conclusion.
Do I need to summarize the things you teach me or give you feedback?
Yeah.
So in this session, I learned the differences between the oxygen delivery devices and the differences between low flow of oxygen and the different situation using the devices and also something I need to pay attention to when I use the devices and that's all clear for me. So you did a good job.
Okay, thank you.
Thank you for teaching me.